Welcome to KidzDocTalk with Dr. Jennie. Today, our guest is Dr. Melissa Kivitz-Krantzow, discussing common pediatric emergencies and injuries. Dr. Krantzow attended medical school at Albany Medical College and completed her pediatric residency at Cornell, New York Presbyterian. She then went on to a pediatric ER fellowship at Long Island Jewish Cohen Children's Medical Center. Dr. Krantzow worked at Joe DiMaggio Children's Hospital, West Boca Medical Center, and is currently working at PM Pediatrics in Parkland, Florida. In her free time, she enjoys spending time with her husband, 3 children, and 1 Labradoodle. Welcome, Dr. Krantzow.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the Director of Telemedicine at Pediatric Associates.
Hi, Melissa. Welcome. Thank you so
Hi.
much for joining.
Thank you so much. I'm so excited to be here today. Thank you for having me.
Sure. So let's jump right in because we have a lot of things I want to cover. The first kind of common thing that I want to talk a little bit about is swallowing stuff that we're not supposed to be swallowing, right? So kids tend to put stuff in their mouth all the time that we don't necessarily want. Talk to us a little bit about kind of common things that you see in the urgent care and ED in terms of foreign bodies that get swallowed. What are some dangerous ones versus less dangerous ones? And what should parents do when they think something like this happened?
Sure. And those are great questions. This is something that we see very commonly in the pediatric ER and urgent care because kids are curious and they just like to put things in their mouths, my own kids included. So the good news is that the most commonly ingested objects are usually actually the least dangerous ones. So coins by far are the most common foreign body ingestion. Kids love to just put coins in their mouths when they see them. Other common ones that we see though are toys or toy parts, batteries, button batteries, and magnets. So again, the good news is that the most commonly ingested foreign body, which is a coin, are usually likely to pass on their own and typically don't cause any significant problems, especially if they get to the stomach. In fact, only about 10 to 20% of kids who swallow a foreign body overall need any sort of procedure to remove it. So that's reassuring in and of itself, right? A lot of times we just watch these kids and let them pass on their own. But there are definitely things to look out for that mean your child needs to get checked immediately if they swallowed a foreign body. So if you see them pop something in their mouth and they have any trouble breathing afterwards, any coughing, drooling, or difficulty swallowing their own saliva, if they start vomiting or complaining about stomach pain, then these are definitely signs that your child should be checked right away. This object might be stuck higher up than the stomach, or it might be in like a dangerous location. And these situations, sometimes they do need to be removed. The other concerning object that we worry about with ingestions, specifically in kids, are batteries and button batteries. And the reason is both of these can actually damage the inside lining of your esophagus in your stomach. So these can cause internal burns and damage. So these often need to be removed right away. Now, I want to just sort of talk about what to do if your child swallows a foreign body and if you see it happen. So typically, when you see your kid, put a marble or a coin or something in their mouth, the number one rule is to not give them anything to drink or eat, until you make sure they're okay, until you talk to your doctor, because just in case any procedure needs to be done and we need to remove it, we don't want any food or liquid in their stomach. That could be dangerous. There's one interesting exception to this. So if you see your child ingest a button battery, and these are becoming more and more common in households to have, they're used in a lot of devices and watches. If you see your child swallow a button battery and they're over 1 year of age, it actually is recommended to give them a dose of honey, meaning like 5 to 10 mLs, just like, a little measuring cup, the liquid that you use for medicine, 5 to 10 mLs of honey at home before you even bring them to the ER, because there's evidence that this actually helps to neutralize the battery so that it doesn't cause as bad a burn in the esophagus and the stomach. Obviously, call your doctor, if you think your child did, just to confirm. And you can also call, there's a button battery hotline, maybe we can put at the bottom of this podcast to include for parents. But I just want to note that because, typically we always say, don't give them anything, but there is that one exception with batteries. And that's important to know about because if given right away, it can actually help prevent some damage to the esophagus.
That's so interesting. I actually learned that myself recently about the honey. So I thought that was a really great and practical tip. Do you typically recommend that any suspected foreign body ingestion, regardless if it's, a benign thing like a coin or something a little bit more potentially dangerous like a button battery, should all those necessarily get an X-ray? Do we really care where the location is? Or if it's something like, not a sharp toy, is it okay to kind of just sit on it?
Right. That's a great question. And it sort of depends, but as an overall answer for a young child, like a toddler or a little kid who may have ingested something, like they come up to you and say, Mommy, I swallowed this. Or if you see them, overall, yes, I do recommend for parents to bring them in. And the reason is, the location of the foreign object sort of determines the next steps that we do. So we'll get an X-ray, when we suspect any foreign body, whether or not the kid said it or the parents saw it, we'll get an X-ray basically of, their neck, their chest, their stomach. We include everything to try and see where it's located. Because if it's located in a position that's higher up, like above the stomach, sometimes that can be a dangerous place for an object to stay. And either they need closer monitoring or sometimes it needs to be removed. However, if it's an object that's not as dangerous, like a toy or coin, and we see that it's already in the stomach, then chances are we'll, tell parents what to look out for: vomiting, difficulty breathing, drooling, and send you home. Sometimes we have parents come back and get what we call serial X-rays, meaning you can do an X-ray like every few days or every week to check the progress of the foreign body and see if it's moving down the GI tract as it should be. And we also have parents obviously look at the stool, look at their bowel movements at home to sort of track and see, that it's coming out the other end. So yes, location matters when it comes to foreign bodies. So even if the child has no symptoms and looks great, overall, I do in general tell parents to bring their child in for an X-ray just so we can have an idea of where the object is and what the next steps may be. So while we're on the subject of kids putting objects in places they're not supposed to go, I just wanted to mention kids putting objects in their nose, because this is another common thing that we see. They love to put beads, crayons, little toys, anything they can find up their nose. And there's actually a trick that you can try at home before you bring your child to the doctor to try and get this foreign body out. And this trick is actually pretty simple. It's something called the mother's kiss. So what you do, say your child runs over to you and says, "Look, Mommy, I put a bead in my nose." And you look up and you see in the right side of the nose, there's like a hot pink little bead. It's too far up to reach though. So you can try what's called the mother's kiss. So essentially, you put your finger over the unaffected nostril. So if the bead is in the right side of the nose, you put your finger over the left side and push it closed. You want it to be completely closed, what we call occluded. Then you place your mouth over the child's entire mouth. So you want to create a firm seal, almost as if you're doing mouth-to-mouth resuscitation. After you make that seal and you're holding down the unaffected side of the nose, you make a big exhalation, almost like a short burst of air. So you're blowing into their mouth, but you don't want it to be a long, soft blow. You want it to be a fast and sort of a forceful blow into their mouth. That pressure, when you blow into their mouth, can sometimes help to dislodge the object, and it often will come out of their nose. Now, this is certainly not in 100% success rate, but this has actually been studied. And in studies across the board, it shows approximately, if the object is not too high up, approximately 60% of the time, this actually works. And even if it doesn't work, it can bring the object lower down into the nose so that it's more easily accessible. They've also shown when studying this method that it's very unlikely to cause any harm. You're not going to do anything bad or make it go further up into the child's nose. So it's something to at least try and potentially avoid a visit to the doctor. The one caveat to this is if it's a battery or a button battery, as we've talked about before, those objects are a little bit more dangerous. So I wouldn't try it for those. But if it's any other regular object, a toy, a crayon, or a bead, give this a try and just perhaps it might save you a visit to the doctor.
Thank you for that. That's a really nifty trick. So I think it's important to mention that that is a nice and safe sort of approach to try. But I think a lot of people's first instinct is to reach for like a sharp tool or like a fork or some long utensil and try to scoop that object out. And we definitely don't want that because a lot of times right, it can push that object further up. It can cause bleeding and irritation and actually make it more difficult later on for doctors to actually retrieve it.
Exactly. Yes. I would steer clear of using any instrument at home, but give the mother's kiss a try. And, at least you can say you tried that, before you bring them into the doctor.
Fantastic. Okay. Really, really helpful tips. So I want to switch gears a little bit and talk about head injuries. So seeing tons and tons of these, we see this in the general pediatrician's office, see these on telemedicine. I'm sure the ER and urgent care is full of these. And not all head injuries are created equal, right? Just like not all foreign bodies are created equal. So tell us a little bit about how we determine the risk of something significant with a head injury, and does every single kid with a head injury necessarily need a CT or a CAT?
Absolutely. That's a great question. So this is a really important topic, sort of near and dear to my heart too, because number one, this happens all the time in kids. And two, we actually have a wealth of information on this topic, which is nice. And this is thanks to like a huge research network called PCARN, which looked at thousands and thousands of children who had head trauma and came, to get evaluated by the doctor. And it basically looked to risk stratify them. So it looked at what were red flags in kids that suggested that they had a brain injury, meaning who needs to get a head CT and who doesn't need to get a head CT. And the reason we care about this is because there is the risk of radiation with kids getting head CTs. So it's not a knee-jerk reflex that any head injury should get, a CT. So because of this network that came about, the PCARN, we actually have a lot of great information on what makes a child higher risk, meaning they're more likely to have an internal like brain injury or brain bleed, and what makes them lower risk. And you can parents can look at this tool at home on their computer too. And we can provide a link for this also, perhaps. It's called PCARN, and you can plug in sort of all the information about your child. But overall, what we look at, number one, is the mechanism of the injury, the head injury. So for little kids, like less than 2 years of age, we say that a fall of more than 3 feet is like a higher impact, more dangerous injury. For older kids, we use a height of 5 feet. Being struck by any high impact object, like a baseball, that makes it a higher risk also. Obviously, a high impact fall from like a bicycle, if you fly over the handlebars, or a motor vehicle accident, those are more high impact injuries. So we automatically worry more about those. It doesn't mean they'll automatically get a CT, but it sort of puts them in a higher risk group from the start. So in terms of the child, things to look for, to see if there's any red flags or if it's more reassuring. So one is their mental status. How are they acting after the injury? Are they fussy or crying or confused? If they're a baby, if it's an older kid, are they, asking repetitive questions or confused about what happened? Just their general sort of mental state and how they're talking and behaving gives us a lot of information. So if they're acting totally normal and they don't have any vomiting or any severe headaches and they're not sleepy, automatically, those are all really, really reassuring things to us as a pediatrician. So if they get a big goose egg on their head, that's the other big question, when do we worry about that or not? So the ones that we don't worry about are actually the ones on the forehead. the frontal ones, because that's the thickest part of the skull and the most protected area of the brain. So kids get big old goose eggs on their forehead, but we usually aren't so concerned about them as long as, they're acting okay and not vomiting, because the brain is very well protected there. A big goose egg on any other part of the head is a little bit more concerning. So again, these are things that we use to sort of look at the child and see, okay, are there concerning, features or not concerning features when we decide who should get a head CT or not. The other thing about head injuries is that they can cause concussions, and concussion can have a lot of similar overlapping symptoms as a brain injury, right? It can cause headache, nausea or vomiting, dizziness, confusion. And we don't necessarily know right away when a child is having these symptoms if it's from a concussion or if it's from a brain injury, like a brain bleed. So when we look at the child, we sort of have to weigh how many concerning features do they have or not have when we decide to get a head CT. And when we get the head CT, really all we're looking for is a sign of a brain bleed or a fracture. We won't see a concussion on the CAT scan. That is really a clinical diagnosis. But again, sometimes clinically, it can be hard to know if a child is having like vomiting or headache, if it's from a brain bleed or if it's from a concussion. So just for a real life example, so like say your toddler climbs over the crib edge, falls out of the crib, lands on their head on the floor, starts crying right away. Like, what do you do? So obviously call your pediatrician if you have any specific questions, but overall, in the vast majority of these cases, the kids are fine. So why? Because one, we already talked about the height. This is not like a high height that they're falling from. So it's usually not what we consider a high impact injury. Two, if they're, crying right away, that's a good sign. They didn't lose consciousness. And then three, most of the time these kids calm down and are fine afterwards. We as the parents are the ones freaked out. They're fine, drinking their milk afterwards, they're calm. So if your child is acting totally calm, not vomiting, is fine after the injury, chances are in the vast majority of these cases, they are just fine. And we usually do not need to get a head CT, on these kids. Obviously, get them checked when in doubt or call your pediatrician. But again, if there are no red flag symptoms like confusion, vomiting, headache, or big lumps or bumps, anywhere on the head besides the front, then these kids usually are just fine and don't need a head CT.
That's really helpful. And I'm glad you kind of brought up the concussion piece of it, because I find that we see that pretty commonly as well, especially after a head injury that maybe was severe enough to require imaging. The imaging was normal, but the kid is still having some symptoms afterwards. I find that parents are sometimes very nervous about kind of long-term issues with concussions, and even in the short term, maybe feel like they have to wake the kid up often from sleep and things like that. So, and any thoughts on that? Any evidence that is helpful? Any helpful at all, or should we be nervous letting kids with a known concussion sleep through the night?
That's a great question. So, so for some kids that we decide not to get a CT or image them in the ER, what we tell parents, if say they have a headache, but nothing else concerning, everything else is reassuring. They just have a headache. So what we do is say, watch them for 4 hours, because if there's anything that's really going on in the brain in terms of like a brain bleed or brain injury, they're going to start to have some other symptoms, other things will manifest within a few hours after the injury. Okay. So after 4 hours, if the child is stable, they haven't developed any, confusion or vomiting or any other severe symptoms, there's really such a low risk that anything is wrong. So they might still have a little bit of a headache, but as long as nothing's progressed or gotten worse after that 4 hour mark, I tell parents to rest assured, like you do not have to keep waking your child up the entire duration of the night, every hour. It's just going to make everyone crankier and make the headache worse. So we do recommend that initial period of monitoring for a few hours. And sometimes we even do that in the ER. If we choose not to get a CAT scan, we might watch the child for a few hours. But after that point, no, there is no evidence at all that shows that waking the child up throughout the evening is going to do anything. So you can just let them rest.
Okay, so we talked about ingested foreign bodies, some head injuries. I want to talk about burns because I feel like we're seeing so much of these. I don't know if it's right, summer holidays, Memorial Day, 4th of July, right? Lots of fireworks, lots of barbecues. So talk to us a little bit about kind of common burn injuries that we see in kids and the spectrum of when everything's okay and can be treated at home versus when we should really be worried.
Right. So again, this is another thing we see a lot because kids are so curious and they often want to be part of everything and help out with everything. The most common types of burns that we see are like the little toddler or little child who pulls down like a pot of boiling water from the stove when they're in the kitchen, or pulls down that mug of hot coffee that's just sitting right on the countertop edge. So those are still the most common types of injuries that we see, like those scald injuries from kids just sort of getting hot liquid spilled on themselves. So burns can be classified in a couple of ways, and that sort of gives us an idea of if they can be treated at home or treated, if they need to be treated by a doctor or if they need to see a burn specialist. So that's really helpful to understand because off the bat, you can sort of know how severe it is. So one of the things we look at is how extensive the burn is, like how much of the body does it cover? And then the other is how deep the burn is. Is it just like the superficial layer of skin or does it go deeper? So say if a child pulls like a pot of, boiling water down on themselves and it's all over their arm and it's red, what do you look for to know, if it's superficial or deeper? So if it's just red and there's no blisters on it, chances are it's more of a superficial burn. The red, painful burns, those are usually not too deep into the skin. If, however, it's red and painful and you see blisters that develop right away on it, like those large fluid-filled blisters, this usually means that it's a little bit into the deeper layers. If it's very, very deep, it actually becomes a little bit whitish in color. It loses that redness, and that child will not necessarily have pain right away, or they'll have pain right away, but it'll go away quicker because the nerve endings are sort of burned off too. So overall for parents, usually it's the red burns that we see, and those are superficial. But if it has blisters on it, I definitely, would recommend that they get it checked because that can mean it's deeper into the skin. So what can you do at home if your child gets a burn, right away? There's like so many things out there. I've heard toothpaste, butter, ice packs, there's all these tricks of the trade that you hear. But what actually makes it better? The first thing is remove all the clothing or jewelry or accessories that might be in that area on the child, okay? Because they can have swelling that occurs after the burn. So if their hand gets burned and, they have like bracelets or rings on, first take those off. The second thing to do right away is to put it under cool running water. And we say cool running water actually for 20 minutes is the optimal time for a burn. And that's a lot more time than people usually do. And people realize a lot of people will put it under cool running water for like a minute or two, and then, okay, take it out. And what's the next step? That is the next step, just to keep it under cool running water. There was actually a study that looked at the optimal time. How long should you keep it? Should it be 5 minutes, 10 minutes, 30 minutes? And they found 20 minutes was actually the best amount of time. It helped to improve outcomes long-term in kids who had burns. Past 20 minutes, it actually didn't help at all. So 30 minutes, too long, but 20 minutes is great. Now, this doesn't mean that you need to set a timer, if your kid gets a burn, but keep that burn under cool running water for at least like 15, 20 minutes as best you can, because that will really help your child, the burn long-term. The other thing that we talk about when we see if a child needs to have, a pediatrician evaluate them or they just can be managed at home is where the burn is. So any burns on the face, covering the hands, the feet, or the groin are usually more concerning just because it can cause long-term issues with like the skin contracting and scarring. So these kids usually need to go to the ER and perhaps see, a burn specialist later on. So again, the hands, the feet, over the groin, and the face. These kids typically should be seen in person by a doctor afterwards. The other concerning type of burn is if it's all around the arm. So we call these circumferential, meaning the entire arm, the whole way around, not just like the top of the forearm, but the whole way around is burned. Those are more concerning too. That can cause issues with the skin getting too swollen, and it can be dangerous if a burn is not treated appropriately. So if it's surrounding the entire arm or leg, what we call circumferential, that's also a burn that should be checked out in the ER or by your doctor right away. So after you do the cool running water, what other things can you do at home? Well, number one, pain control. Sometimes parents don't think of it in the heat of the moment when they're panicked and a burn happens, but these are painful. So I would recommend either Tylenol or Motrin or both that you can give, whatever you have at home, while you're holding that extremity or something under cool running water, just give them some Tylenol or Motrin off the bat. Okay. The next thing is, we don't want you to put like any strong chemicals or anything on it, because this is almost like an open wound. So if you want to clean the burn, if there's like debris or stuff on it, just use soap and water. Okay. We don't want like any chemicals or anything harsh to be put on it at home. Now, I had mentioned earlier, if there's blisters present, that's an indication to see a doctor, because again, this can mean that there is a deeper level of skin involved and that these are more deeper thickness burn. Sometimes these blisters, if they rupture on their own, we sort of have to take away the bits of dead skin, and we'll cover it with like an antibiotic ointment, like bacitracin, and a dressing to keep it clean and dry. So if it's at that level where there is a burn that has blistered or a blister that has popped open, I typically say you should bring them in for the reasons mentioned, but also they might need the doctor to sort of do some wound care, to take off some of the dead skin, to put on antibiotic ointment, to put on a special dressing. And those are typically things that should be seen by the doctor.
So what about the superficial burns that don't necessarily need a doctor's visit, right? They're like we said, right? Very superficial. Any kind of wound care that parents should be doing at home. Sometimes we hear, yes, Neosporin, no Neosporin, yes, Silvadine, no Silvadine, yes, cover it, no, don't cover it. So obviously the deeper ones, right, the doctor will look at and treat appropriately, but what about those that parent is trying to take care of at home?
Sure. So after the initial cool running water, 20 minutes of cool running water, you can gently clean it with soap and water. If it's a superficial burn, like it's just red, it's on the arm or the leg, and there's none of those concerning features, you can go ahead and actually take care of it at home. Now, I typically don't recommend Neosporin because a lot of kids actually have like a contact allergy to Neosporin, and it can make things worse. It can make it itchy or red, but plain old bacitracin is usually the best thing. It's sometimes parents have this on hand, sometimes not. If you do, that's great. I would just cover the whole burned area with bacitracin. If you don't have bacitracin at home, there's actually studies showing that as long as it's, cleaned well and it's not like a dirty area, you can just put Vaseline on it too, just to keep it covered. So either bacitracin or Vaseline, cover the burned area. And then I would typically cover it with what we call like a non-adherent dressing, meaning a non-sticky dressing. We don't want gauze, plain gauze, because that can stick to the burn and pull off more of the skin. So it depends sometimes on what you have at home. But if you have like a non-adherent piece of like gauze, or if you have just like a bandage that can cover it, even like a wrap, that will work too, just to keep the area clean and dry. So again, Vaseline or bacitracin over the wound, and then keep it covered, because we don't want any bacteria getting in this area. We want to keep it covered. We want to keep it clean. So as best you can, with what you have at home, just to cover it with something that's not going to stick to it. So a non-adherent dressing, whether that's an ACE wrap or a bandage or anything that you can have at home that's clean.
Fantastic. Makes sense. So now let's talk about something way, way more common and hopefully a lot less painful and dangerous, which are insect bites, right? So we see tons of these on telemedicine in the office. I'm sure the urgent care is filled with them, and sometimes they can look really scary and big and red. So let's talk a little bit about sort of the common things that you guys do to address insect bites, and are these ever dangerous or alarming?
Sure. Yeah, well, unfortunately, in Florida and in the summertime, this is going to be an issue that comes up a lot. So most of the time, the bites that we see are just bothersome and annoying. It's very rare that an insect bite is dangerous. A lot of times, kids will get sort of an instant reaction to a mosquito bite where they get a lot of redness and swelling around the bite. And that's just the normal reaction to the bite. It doesn't mean it's dangerous. And these typically recede in a few hours. There are some things you can do at home if they're really bothering your child. You can put an ice pack on the area. You can give them an over-the-counter antihistamine like Benadryl if it's really itchy or bothering them. But again, these typically, they're red and swollen at first and they look really bad, but then within a few hours, they sort of recede and go back down. Now, there are some children who have what's called actually Skeeter syndrome, where they get like a local allergic reaction to the bite itself. So the kids normally who, just get an insect bite, again, they'll have the redness, they'll have the swelling, but it goes away, it recedes pretty quickly. These kids have a bigger reaction. It looks like the whole, arm might be swollen, red, hot, inflamed. And obviously this can be really bothersome to the child too. So again, put an ice pack on, just as I mentioned before, elevate the area. So if it's on the arm, elevate it right away. And I would go ahead and give an antihistamine like Benadryl, and you can put on an over-the-counter hydrocortisone cream to these too. Now, these are not dangerous to the child if it's just like that local, reaction. If the child starts to get hives everywhere on their body, swelling of their face, their lips, anywhere else, that should be checked by a doctor right away. That's concerning for a true allergic reaction in the body, like anaphylaxis. But again, with the local reactions, like Skeeter syndrome, where these kids have local reactions, these aren't dangerous. They're just really bothersome to the children. For a bee or wasp sting, things like that, sometimes the stingers can still be in place after, the child is bitten. So if you see a stinger in, the child's, arm or leg, try to remove it as quickly as possible with a scraping motion. You don't necessarily want to pick it. It can embed the stinger deeper in there. So just to use an edge of a credit card or something, just to sort of scrape it off in a quick motion, and then wash the area right away with soap and water to remove any residual, anything there that could be from the stinger. And then, same as we said before, putting an ice pack on, elevating the area, giving an antihistamine or Tylenol or Motrin, those are the next best bets. So again, overall, most insect bites that we see are not dangerous. Even if they get really red and swollen, they typically will go away on their own. So that's reassuring for parents to know. But in the meantime, ice packs, elevate, antihistamines, and Tylenol or Motrin. One thing I do want to mention, I've been seeing a lot more of this lately, is that sometimes when kids get bites, they might be red initially, it might go away, but sometimes if there's open skin there and the kids are scratching at it, it can sort of act as like a nidus for bacteria to get into the skin, and it can cause an infection days later, something we call cellulitis, which is an infection of the skin and the soft tissue. So they may have, 5 insect bites all over their ankles. They're scratching at it like crazy. It looks better, but then you notice 4 days later, that the skin is really red, swollen, and painful. So if that happens where it's days later and the area is red and inflamed, it could be that there's a cellulitis developing. So those should definitely be checked by the doctor, because if it is cellulitis, it will need antibiotics to get better.
For sure. And I think especially those kids with Skeeter syndrome, sometimes that redness can be so impressive looking that in the beginning,
Yes.
right? Sometimes I think is this a cellulitis that developed? So sometimes I'll tell parents to kind of mark the borders, and right, if it's just a localized reaction, in theory, that redness should be getting smaller, right? Should be.
And One of the things we do sometimes too, like in the clinic, so demarcating, definitely, I'll use a pen and literally outline the area. The other thing is sometimes you can give like Benadryl or an antihistamine, both for treatment and for diagnosis, because if it's a reaction and you give them Benadryl, one, yes, it'll make them feel better, but two, it should really start to recede. The redness will get better, the swelling will get better. Whereas if it's a cellulitis, Benadryl is not going to change that, because again, cellulitis will need antibiotics. So that's a really good point too, just for parents, that they can give Benadryl and it can help in two ways: to treat their, discomfort, but also to know, if it's just a bad local reaction or if it's a cellulitis starting.
So fantastic. So lots of good information about kind of things we see commonly, but what else are you guys seeing now frequently in the ER urgent care? What other kind of summertime, right, or warm weather type of injuries should parents be wary of?
Yeah, so summertime is a great time for injuries to happen because kids are doing more, right? They're outside, they're using, their bikes, their scooters, they're at the playground more, trampolines, swimming. So it's our sort of peak time for injuries actually in the ER, but there are definitely things that, parents can know about and be aware of to help sort of reduce the likelihood of these injuries. So the first thing I actually want to talk about is trampolines in particular. So trampolines, I know, are like a big, they're a hot button topic because kids love them and they want to be on them, but they're actually really dangerous. So the American Academy of Pediatrics, the AAP, actually doesn't recommend trampolines at all to have in terms of being a recreational, fun activity at home, because they can cause so many different types of injuries. They can cause lower extremity injuries, they can cause fractures, dislocations, but most concerningly, from our perspective, is that they can cause head and neck injuries. And these can sometimes be severe. You can hurt your cervical spine, or, as we talked about before, head injuries. These can cause significant head injuries or, brain bleeds. So trampolines really, really are not recommended. That being said, the American Academy of Pediatrics and all these health organizations recognize that sometimes it's going to happen and kids are going to go on trampolines. So if a kid is going to go on a trampoline, at least are there some baseline rules to make it a little bit safer for them? So there are a couple of things. First, one person at a time. So that's one of the number one things that you can do. Again, it's not recommended to have a trampoline at home, but if you do, or your neighbor invites you over or there's a trampoline there. So the first rule is one kid at a time. There's less risk of collision, less risk of them bumping into each other, bouncing, into the side. Multiple jumpers actually increase the risk of injury, even with adult supervision, it's been shown. So that's step one, something that you can do if they are going onto a trampoline. Two, make sure that you set some ground rules and have no flips or somersaults. Kids love to experiment and, pretend they're gymnasts, but these are actually really dangerous to do on a trampoline because these are the ones that can cause kids to get head and neck injuries, including cervical spine injuries that can be really dangerous. So set some ground rules, that no flipping, no crazy somersaults or, twists. And then three, before anyone uses the trampoline, you as the parent, just check each time that the netting and the padding is intact, that there's no holes that the child could fall through, that they could get stuck in, and make sure that the trampoline is on a flat and stable surface. It shouldn't be uneven or somewhere where, one side is a little tilted. Make sure everything around it is clear, that it's flat and stable, and again, that the netting and the padding are intact. So yeah, in terms of trampolines, at least there's some ground rules that you can lay to sort of help make it a little bit safer, even though it can cause a lot of injuries.
Well, I'm glad you mentioned that. And is there any difference in risk of like that kind of at-home backyard trampoline that I think the AAP really, refers to when it makes that recommendation versus, those trampoline parks where kind of like the whole room is one big trampoline, right? So we have a very strict no trampoline policy with my kids, but then I'm always a little bit conflicted.
We have that
right?
too.
with like, right? So you can always tell the pediatricians' kids, right?
Yes.
The ones that stand off and watch everybody else jump. But what about those kind of like their trampoline parks, right? There's birthday birthday parties
Sure.
there. So I'm always kind of conflicted on how I feel about safety at those places.
Yeah, that's a really good question, because I think those are actually sometimes even more common than the home trampoline in this day and age, for having parties and get-togethers. So overall, unfortunately, the risk is still the same with those trampoline parks, meaning all these types of injuries, these fractures, head and neck injuries, dislocations, they're not less likely to occur just because it's a trampoline park. Unfortunately, the same types of injuries can happen there. And oftentimes, because these are, for birthday parties or, it's a get together, just as we mentioned before, how it's safer for one child to be on at a time. There's often a lot of kids on these huge areas, of jumping, which again, as we talked about, can lead to more collisions. So, I wish I had a different answer for you, but unfortunately, these trampoline parks are just as high of a risk as having a regular home trampoline. Now, that being said, there, same as I had mentioned before, there are some ground rules you can set to make it as safe as possible with the home trampoline. And you can enforce those at a park too, a trampoline park. So making sure that your child is not jumping in close proximity to other children, making sure they know not to do flips or somersaults, and just staying in one area. Certainly these things are helpful for reducing some of the risk, but overall, unfortunately, those trampoline parks, carry just as much risk as the home trampoline.
Okay. All right. Sad news, but
Yes.
important from a safety perspective. All right. We covered so much. So is there anything else, any like major kind of safety things that you really want parents to walk away from this feeling good about?
One of the other things I just wanted to mention from a summertime perspective, especially, is just helmet use. So I had mentioned before, summertime is the time for scooters and bikes and doing all those fun outdoor activities, which is great. We want to get kids exercising and out there. So I'm, fully supportive of all those activities. But no matter, the street you're on, if it's a small, tiny street with no cars, no matter the age of the child, if it's a 3-year-old and they're on a low bike, with training wheels, no matter what, the rule should always be, if there are wheels, there is a helmet. Even kids who, are scooting down the street on their tiny scooters, just a couple feet off, if they, fall the wrong way, fly over the handlebars and hit their head, and we just talked about head injuries, they can really have, a significant impact if there's no helmet on. But if there's a helmet on, that is so protective, and it really, really makes a big difference for these types of injuries. So even my 2-year-old knows, he is a little daredevil and he loves to scoot down the street as fast as he can, but he knows no helmet, no scooting. So anytime a child is on a bike or scooter, again, even if you think it's an area that's pretty safe, like a small, cul-de-sac, or even just like in your driveway, up and down your driveway, again, if they're moving and they're on wheels, they should always have a helmet on. And just to remind parents too, to make sure that the helmet is fit properly. So the strap should be sort of snug underneath, when you buckle it on their neck. It shouldn't be moving around, falling into their eyes when they're biking or scooting. So just do like a double check every time, if you're putting a helmet on too, that it's fitting properly. So just want to put that plug out there because that is something we see so much, in this summer season, and helmets can be so protective for them.
100%. Okay. That was super helpful. Thank you so much for all this information. This was fantastic.
Thank you so much.
You can come back again soon.
Yes, I hope so. Thank you again for having me.
Make sure you like us on Facebook and follow us on Instagram and Twitter. Thank you for joining us on KidzDocTalk.